If you play cricket, tennis, football, kabaddi, etc., and you have vague some sort of knee pain, you go to a doctor, you are recommended to take an MRI, and your MRI report says meniscus tear. Did your heart sink a little, and did you Google knee surgery recovery time at 2 a.m. in the morning? And did you suddenly feel like your sports life is over? Pause a little. You cannot unsee your MRI report, but you can understand it correctly. That's what this video is about. Just wait for 10 minutes, look at this video, and you'll understand why. I am Dr. Naveen Tiago, orthopedic surgeon and sports injury specialist. This channel is about sports performance, sports injury prevention, longevity, joint health, and so on. Let me start with something surprising. A landmark study published in New England Journal of Medicine in 2008 found 35% of the adults between 50 to 90-year-old had meniscus tear on MRI, and 2/3 of them had no knee pain. That means many meniscus tears are incidental findings, and in other words, a meniscus tear on MRI does not automatically mean it is the cause of your knee pain. Let me discuss about a 42-year-old gentleman, a weekend cricket player with vague knee pain with the MRI report showing complex degenerative meniscal tear with mild effusion, that is swelling of the knee, and mild thinning of the cartilage. He walked in holding the report like it was a court verdict. He said, "Doctor, my knee is finished, right?" And I asked him, "Can you walk?" He said, "Yes." "Can you climb stairs?" "Yes." "Is your knee locking?" He said, "No." Then I told him something that made him laugh. If we MRI scanned every 40-plus-year-old who plays cricket or football on Sundays, we would need a separate waiting room just for meniscus tears alone. An MRI is like opening the service history of a 10-year-old car. You will find somewhere some scratches, some aging rubber, but that doesn't mean the engine has failed. Or think of this, when your hair turns gray at 40, we don't call it degenerative scalp disease. The word degenerative sounds dramatic, and it usually just means age-related change. That's what sometimes or many a times a meniscus tear implies when patients come with knee pain. Now let's talk about the highest level evidence, the FIDELITY trial from Finland, published in New England Journal of Medicine. This was a randomized placebo-controlled surgical trial of 146 patients aged between 35 to 65 years, degenerative medial meniscus tear, and no advanced osteoarthritis. They were divided into two groups. The group 1 underwent arthroscopic partial meniscectomy (APM), and the other group underwent a real arthroscopy but without therapeutic resection of the meniscus. Results at 1 year: no significant difference in pain, no significant difference in function. A 5-year follow-up published in British Journal of Sports Medicine, still no meaningful difference in patient-reported outcomes. There was even slightly more radiographic osteoarthritis progression in surgery group. Other high-level trials like METEOR, NEJM, and ESCAPE JAMA 5-year follow-up show similar findings. Structural physiotherapy, physical therapy can be non-inferior to surgery in many degenerative tears. Now, let me be very clear. MRI findings should not be ignored, and surgery is absolutely appropriate when there is a true mechanical locking, a displaced bucket handle tear where the meniscus is ripped off into two parts, a root tear, an acute traumatic tear in athletes, persistent instability, and failure of structure rehabilitation program. Imaging is extremely valuable, but it must be interpreted in the clinical context. An MRI is one piece of the puzzle, and it should guide decisions and not dictate them. If you are in the middle age, 45 plus, and active, knee pain is often caused by sudden load spike, a weak quadriceps, poor hip control, synovitis, bone marrow edema, and so on. The pain is a biological response, not always a structural disaster. Many knees in this age group improve with load modification, progressive strengthening, patience, and smart return to sport planning. Coming back to my 42-year-old cricketer, we did not operate, we just modified load, strengthened the quads and the glutes, controlled inflammation, and reintroduced the sports gradually, and 3 months to 4 months later, he is back to playing and no surgery. If your MRI says meniscus tear, pause, ask, is this traumatic or degenerative? Is there a true locking? Have I tried structural rehabilitations? Discuss fully with your orthopedic surgeon and take a call. Disclaimer: this video is intended for educational and information purpose only. It does not create a doctor-patient relationship. It does not replace individualized medical consultation, physical examination, or imaging review. Meniscal tears vary significantly in type, size, location, and stability. Certain tears, which include traumatic, displaced, locking, or root tears, may require surgical intervention. MRI findings must always be interpreted in the context of clinical history, physical examination, functional limitation, and patient goals. Treatment decisions should be made in consultation with your treating orthopedic surgeon. The purpose of this video is to promote evidence-based, individualized decision making, not to discourage appropriate surgical care. Subscribe to such evidence-based content regarding sports performance, longevity. Don't forget to press the bell button. Share with your friends and relatives who would definitely benefit from such videos. See you in the next video. Goodbye.